Hello, and welcome to this session on overuse injury prevention and rehabilitation in horn pedagogy. My name is Dr. Jena Gardner, and I teach horn at Western Illinois University. In addition to being a performer and a teacher, I'm a parent, a wife, an amateur gardener, and recently have become a musician's wellness enthusiast. I'm excited to talk with you about how we can change the culture of injury through the way we teach the horn today. So to start here, I want to talk a little bit about how I ended up on this topic. It's a personal topic to me in two very important ways. The first is that I suffered an embouchure injury during the fall of 2019. I had a number of mitigating factors like a heavy performance load, sleep deprivation and stress. My son was just over a year old at the time. And I had some horn maintenance issues. And those are just a few of the factors. There's probably others that I'm not getting to. On the screen, you'll see a selfie that I took around the time that I was injured. I was on tour with the Cobalt Quartet, and I was in a lot of pain, and I just noticed in this right side of my cheek a lot of swelling. And you can see from probably from my facial expression, I was not in a happy place. And now I'm a happy, healthy person, and I'm happy to report that I'm playing again. But once I realized I was injured, I found myself with two really important questions. The first was, how can I evaluate and recover from this injury? And who can I find to help me? I honestly struggled to find the answers to these questions. My experience was one of, I think most people who are injured, which it was very much word of mouth. Colleagues or friends would say to me, oh, talk to so-and-so, or try this thing, read this text. It was very anecdotal, and I felt very alone. Over time, I found my own way, and I've had the support of many people along the way, but it's been a journey. The second reason that this topic is super personal to me is that I'm passionate about teaching. I want my students to go on to have happy and healthy careers without injury. And if they are injured, then at the very least, I want them to know what to do when it happens. From my conversations with others, it's very clear that many of us brass players have similar situations when it comes to lack of information. So why don't we know more? I believe there's a huge opportunity, really, for horn teachers and other brass educators to influence this culture of misunderstanding, misinformation, and sadly shame around embouchure overuse injuries. So I'd like to start with just a little overview of embouchure overuse injuries. First of all, there's very few scientific studies on embouchure injuries, especially if you compare to areas like sports and even dance. Within that, a lot of the research focuses on embouchure dystonia, which is a neurological disorder, versus embouchure overuse. So I'm going to be talking a lot today about the work of Dr. Bronwyn Ackerman. She's an Australian doctor of anatomy, and she specializes in musicians' injuries and has several wonderful lecture videos online, lots of papers that you can read, and I believe she has a lot of work in progress that will be relevant in the very near future. So Dr. Bronwyn Ackerman describes the musician's risk factors as based in the following categories: training errors, so suddenly increasing the amount of time in the practice room or in rehearsals, not getting enough rest. This can also, a lot of these are interrelated, like muscle fatigue and tension. So playing with a lot of tension, overusing certain muscles as compared to others. Poor posture. So over time, the amount of time that we spend in these positions, how we relate to a chair, all these things, they can factor into the likeliness of injury. Biomechanical flaws, things that we move incorrectly or inadequately, like For example, one for me that I really think about a lot is the jaw and the way that the jaw moves, and understanding that really changes the experience in this space for me. Psychological stressors. I think we all know the impact that stress and depression, all these things can have on our horn playing and our bodies. So it goes to show that it factors into the likeliness of injury. And for her general purposes, difficulty using hearing protection is relevant because she's looking at any kind of injury, so injury to the eardrums or inner ear. But I think that this also relates to overuse injury, because if we're experiencing lack of quality sound in our ears, that can contribute to the way that we play. And she makes a really important point, which is that there's very little health education in music training. So in other areas, they might talk about nutrition, they might talk about psychology. We do a little bit when it comes to performing, but not in the sense of overall wellness. In addition to these risk factors, Dr. Ackerman did a study in 2012 of injured professional orchestra musicians. Professional orchestra musicians, actually. 50% of those musicians were currently injured. 26% reported pain lasting more than 3 months, and only 40% fully recovered from past injuries. Now, these are not specific to embouchure overuse injuries. This is general professional musicians, but that's a really high rate of injury. And it's really scary to imagine 40% of injured players are the ones that recover. That means 60% of them feel that they are not fully recovered. Another well-known text that many of you are probably aware of is by Lucinda Lewis. She has the book Broken Embouchures and Embouchure Rehabilitation. To my knowledge, these are the only published works that focus on brass embouchure injury, with an emphasis on this more common overuse injury. In the text, she describes professional wind instruments aren't always, excuse me, I said that wrong. Professional wind instrumentalists aren't always able to control when and how much they play. They have to make a living after all. Unfortunately, heavy playing schedules push many into the unforgiving jaws of overuse. The initial symptoms of overuse are often mistaken for normal fatigue, and most players simply don't know when they are in trouble until well into it. The danger overuse poses is how its lingering symptoms like pain, swelling, and fatigue can set into motion a sequence of events that cause an embouchure to develop a reactive habit. And we'll talk more about that reactive habit in the near future. So it's important to acknowledge that overuse injuries look, feel, and sound different for anyone who experiences them. There are a variety of potential symptoms a brass player might experience. Some of them are easy to notice: pain, lack of endurance, lip swelling or stiffness, loss of register, changes in tone, and other unusual sensations. My injury started as a muscular twitch, and it was only with some time off that I realized I actually had some swelling and some pain. But I wasn't actually aware of that until I took the time to really investigate how I was feeling. But sometimes the player might feel nothing. They simply may be unable to make a sound. Moreover, most players respond initially to these symptoms both consciously and unconsciously, creating new habits and potentially worsening the injury. This is that reactive state that Lucinda Lewis is describing. So you can imagine that if suddenly you can't play high, or your high range, rather, it's not that you can't play, it's not feeling like it normally does. So maybe you press a little bit more, maybe you alter your embouchure just a little bit, put a little more tension or something into your body. These reactive habits become the habit when we play, which can create more injuries, so that when you're returning to playing after time off, now these reactive habits are built into how you play. So if we're to address these career debilitating and sometimes ending injuries, It seems logical that the conversation must start with prevention and the education of brass performers. It's my intention that you walk away from this presentation with a collection of ideas to implement into your own teaching at any level. I teach at the university level, so a lot of these ideas come from my own experience teaching. Many of these ideas may be things that you already do, but with a slight twist or change in emphasis. I should also mention that although my focus here is on overuse injuries of the embouchure, much of the information is applicable to traumatic injuries and focal dystonia, or just general injuries that can develop over a musician's life. So it's really important that we consider these different areas that we can incorporate into our pedagogy. I'm going to summarize them here, and then I'll dive into each one individually. So we have first the connection of mind, body, and spirit. We have our body usage, so our posture, our movement, all those things. Anatomical education, having the knowledge of our bodies, the structures of our bodies and how they work. Healthy practice habits, that one's pretty self-explanatory. Mental and physical health, and finally, having a community of support. Many musicians with time come to realize what an impact our non-music life can have on our music life, and vice versa. We use the same minds and bodies to live our lives as we do to play our instruments. These negative influences can be in the form of chronic stress or illness, major life changes, poor nutrition, aging, fatigue, substance abuse, financial insecurity. There's so many ways that our life and lifestyle can impact our risk of injury or our overall playing. For this reason, embouchure overuse injury prevention benefits from a pedagogy that takes a holistic point of view. To be more specific, educators who incorporate the connection between mind, body, and music making will potentially have fewer students with injuries during their education and beyond during professional careers. Should these players encounter overuse injuries later in life, hopefully they'll have many of the foundational concepts and skills they need to assess and recover from those injuries. I've had the opportunity to interview a number of individuals on their experience working with their own injuries and with injured players. Take a listen to what a few of them had to say about this mind, body, spirit connection.
I mean, this is such a significant piece, and it is the heart of the Alexander technique. It's the heart of Alexander's work, that the mind and the body are unified, and how we think about what we do is paramount. It's the first step. So this idea that we can, be very anxious, eager to jump into action without this piece of critical thinking, and our thinking does dictate what we do in our bodies.
So much research that shows, I say this all the time, the body plays the horn, but the mind plays the body. Mm-hmm. But in classical music, we train the body. We pretty much ignore the mind, and we train the body with muscle memory. That's why the repetition and the rehearsal and the practicing is so important, because the only way that people, some people believe you can play these things really well is through muscle memory. But the reality is that there's no such thing as muscle memory. There's memory.
Right.
And so we need to shift from focus on developing muscle memory to really understanding how to kind of program our minds to play in the most efficient Alexander technique way as possible. We need to shift from strength training and powerlifting philosophies to yoga and meditation philosophies.
In other words, the integration of these overlapping, interconnected elements must be emphasized to students. And in most places, it's contrary to the predominant culture and method of teaching. be the change you wish to see in the world. This quote has always been meaningful to me in many ways, but particularly as an educator. It's very easy to fall into the do as I say, not as I do trap. So first, I think it is most important that we model the proper setup of posture and good breathing for tension-free playing every time we play. And even as we're interacting in a lesson, we might not have our horn in our hands, but using good posture, modeling ease, comfort, while also being engaged is a wonderful example to set for your students. And I think you'll find that they sort of absorb that from you without even having to discuss it. Similarly, during lessons, coachings, rehearsals, it's very important to frequently bring the students awareness to the way they use their body with the instrument and the change in their sound when they reduce tension. Here's Christy Morrell talking about incorporating that in her teaching and in yours.
Like when you're looking at a person when they play, right? When they sit and how they stand, how they approach the instrument. Almost every lesson, sometimes you need to make a correction there, but also realize that you're modeling yourself. When you're sitting or you're standing or whatever, you show them the proper position of your body and the way to breathe. And
finally, in regards to body usage, I think most of us have had some exposure to Alexander technique or other types of body work, but it can be difficult to convey and really easy to misconstrue our own experiences with that, with those techniques or studies. So it is essential to be bringing in professionals, or if you have someone at your university, to have regular sessions with your students, either individually or in group sessions, just anything you can do to encourage students to engage in Alexander technique, Feldenkrais, Aston patterning, yoga, anything that works on this mind and body connection and emphasizes the efficiency and ease of structural support that they can create in their bodies. To be mindful of the design of your teaching space. So I suggest having a variety of chairs or seat cushions in your studio. And if you can get adjustable chairs, that's wonderful. There's some linked on brassinjury.com. But take the time to work with students to find a chair that supports their frame and results in freer movement of air, and thus music. If possible, you can recommend purchasing a seat cushion or even a black towel for your students to be able to adjust suboptimal chairs. This is a real game changer. You know, a lot of chairs have the scoop in the middle, or they're designed for someone who's much shorter or much taller than the student may be. So these seat cushions come in a variety of sizes, or a rolled up towel that you can put behind your back or under your sit bones can be a great way to make sure that your hips are higher than your knees and you have that space to breathe and your spine is in optimal position. It's really important for young students to understand that their relationship to the instrument is going to evolve with their growth, especially if they're starting very young and they have to play on the knee or they're playing on a piano bench next to them. Make sure that they're mentally prepared to adjust. Okay, we don't want them to get locked into a specific feeling, and it's even more important that you are checking in with them constantly. By working with students on a regular basis, you're effectively communicating how important this body usage is to making beautiful sounds, and also establishing habits that reduce the possibility of future injury. And finally, whether you're teaching at home, in a concert hall, or on Zoom, be sure that there is enough space for the student to create a healthy resonant sound. I know a lot of our students are in practice rooms, and I've spent a lot of time playing in my basement and in other practice, suboptimal practice spaces over my educational career. And whenever possible, I think it's important to highlight to students that they play in larger spaces. get into that classroom if it's open, use this, play outside, practice at your church, whatever they need to do, because not only is that going to benefit their playing, but it's going to benefit their body usage to accurately understand what kind of air they take in, how they're going to use that air, and how they're going to fill up a space with their sound. These discussions are often an opportunity to mention that it may be inconvenient to carry around a cushion or hard to schedule additional lessons, but these preventative measures are essential for a player's well-being down the road. I want to talk about anatomy and physiology. In the world of brass pedagogy, there's a lot of information that's been passed down in an oral tradition. There are many dysfunctions around breathing and the embouchure that can be avoided if students have an accurate understanding of their body structures. This should not be anecdotal or feeling based necessarily. Rather, this is like learning the specifics of how things work. So I recommend that you educate yourself and utilize science-based physiological explanations of the body mechanics involved in breathing and using the embouchure. These two areas are specifically important. Returning to the work of Dr. Ackerman, I think it would be great if we all took a listen to what she has to say about the pervasive lack of knowledge among musicians about body function and structure.
Often the way embouchure has been analysed hasn't been based on foundations of anatomy or on the research that we've been doing to better understand how embouchure works. So if you're basing it more or less on what you think you're feeling or what someone might have told you once in a conversation, it may not be the analysis that's right for that person. And as someone who's worked with this area for a long time now, I think it's quite complicated to analyse, but you have to be very systematic. I would also say embouchure is a team player. If we go to a slight sports analogy here, we're not just looking at one muscle doing something. We're looking at a whole lot of muscles that have to work together with other systems like our breathing or our tongue movements, things like this. They have to work together to be able to produce the sound, and this is a part of the team. So the functioning of these facial muscles is incredibly important, and we need to look at it in combination with the other structures.
And of course, you can view this full clip on YouTube, linked from brassinjury.com.
And just awareness, just basic awareness of, do you even know what your body does when you play the horn? I mean, if you just start with that, you think you do, but here it is. This is what your body actually does.
Yeah.
So these are the things that you better keep going if you want to continue to play really well. And
for breathing anatomy, I also recommend Jessica Wolf's Art of Breathing video and David Neesmith's Breathing Book for Horn. It does a really great job of connecting the physical understanding to the kinesthetic experience of breathing and playing the horn. David Neesmith is not only a horn player, but he's also an Alexander Technique teacher and has a certification in body mapping. So this book is particularly excellent. Now, in order to understand the facial muscles involved in horn playing, I think everybody should check out Frankie Losurdo's presentation from the 2021 Northwest Horn Symposium. That's also available on YouTube. And I'm really grateful I had the opportunity to interview Frankie not that long ago, and here's something he had to say about this topic.
So yeah, like you, I had an injury, and there is really no one to, like, who do you call? And that's my big thing, is why brass rehab, why I've started it with this doctor. So in Australia, we're lucky to have one of the world's leading researchers in this area, Bronwyn Ackerman, who you might have read some of her research, but she's one person who is doing research along with some other big names in Germany at the moment. But so we're really lucky that in Australia, we at least have someone that if something happens to you, we're like, oh, maybe she knows what to do. But there's very few actual players out there that know what to do. And so, yeah, I got onto her straight away, and she's a lecturer in anatomy at the University of Sydney. So she's a physio background, like but she's a doctor of anatomy. She's been researching and helping musicians for 25 years, 20 years. So string players, wind players, and brass players. And I learned how to play from scratch from her. And she's not a musician at all. So the question is like, how is this possible that a horn player, a professional horn player, can learn how to play again? I lost everything. I couldn't play. As you saw in the video, I couldn't hold any note. So she didn't know how I used to play. She can't play a note on the horn, but you know, you got to ask the question, how is it possible a physio, a doctor of anatomy, can teach a musician how to play again to a professional level? There's something in that. And this is information that can be shared. It doesn't have to be some oral tradition passed down by the student of a student of.
Of course, playing the horn is not just about knowledge, it's an embodied skill. If you don't have your students using breathing bags or Inspiron breathing devices, consider incorporating them into their lessons regularly. These are great external visual tools that can deepen a student's understanding around air. For college teachers like me, you might make this a required purchase, maybe something that the bookstore could carry instead of an etude or method book. They will make a huge difference. And I want to point out that Inspiron, it comes with a little thing to put in your mouth on the end for breathing in, but I actually prefer to use this way with it upside down, and then I put my mouthpiece into the end to see how much air I'm using, and it'll make the ball come up really nicely when I'm using good air. Embouchure visualizers and sometimes pressure devices can be effective, but I use them in a limited capacity. Students can get really into them to a point where they get fixed on that, and it can become unhealthy. Speaking of unhealthy, let's talk about healthy rehearsal and practice habits. In an ideal world for us brass teachers, students would prioritize fundamentals and their lesson materials over their band, orchestra, and other ensemble repertoire. Unfortunately, that's not always the case, and eager students frequently overdo it by trying to do it all. Many studies have been shown that 45 minutes is the maximum our brains can stay focused without a break. This is a great limit to set on a practice session, or might be something you consider for your lessons and classes. This also allows students who may be in school during your lesson time. This allows them a short break to transition into other classes. So there's less hurry, there's less stress. It has that added benefit of ending before focus is lost and easing that transition into a new activity. Another interview I've had the opportunity to conduct recently was with Judith Saxton. She's a wonderful trumpet player and Alexander Technique teacher. And she had something very interesting to say on rest.
So a wellness person is one that offers ways of fully resting when you're resting. So, you know, we now know scientifically proven that the brain needs 10 minutes to take in new information in a learning environment. We could talk about horn lesson information or, you know, Western music civilization academic class.
Right.
Your brain needs 10 minutes at least to take in that information after it's been presented. So there needs to be more break in between every single class.
Now, we may know that focusing on quality over quantity is important, but most students, they really feel like more is more. And sometimes there's a competition even. Oh, how many hours did you practice? And they're looking at time spent rather than quality. Lessons are a great opportunity to introduce and reinforce efficient practice methods. These methods require no embouchure usage and are really designed for engaging the brain that plays the body, that plays the horn. So things like deep listening, really engaging in a listening experience. almost like meditating while listening to music. Singing. So this can be singing anything, but particularly singing the repertoire you may be working on. And finally, doing mental rehearsal or audiating is really a wonderful skill to develop. It will benefit the students to no end. And there's a lot of studies out there about how mental rehearsal can be even more effective for the brain than physical rehearsal. These strategies are also helpful when a student might have an illness and should not be playing their instrument. During lessons, I make a point to model how to practice something and ask the student to repeat back how we accomplished a goal. This what is usually a great time to point out some things that they may have missed in that process of improvement, so that hopefully they're going to recreate that in the practice room. I'll also add that most students are not clear on the difference between a warm-up and a fundamental session. Many times their warm-ups are too strenuous or just the first session of the day. Helping them to develop a quick warm-up that engages the mind, the body, and the playing mechanism at the start of every session or rehearsal is incredibly beneficial to their playing, both in the short term and the long term. Conversely, a good warm down can help the muscles begin their recovery before the next session. For all of these topics, it's key to follow up with young players to keep them thinking about them all the time and let them know that this is something that's important to you and something they really need to be aware of in their own playing. So mental and physical health. This is a huge topic, and I am not a medical doctor or a therapist. And I don't see that as my job when I'm teaching the horn, but in order to take that holistic approach, that mind, body, spirit approach I talked about in the beginning, is essential to check in with the student and direct them to beneficial resources outside of your expertise. For example, you and your program, if you work for a school or university, could have some referral sheets available. And these can be general referral sheets, resources that are listed for mental health, and they can be online resources. So a student doesn't have to go anywhere. They can be a self-care sheet. So you could have a brainstorm with a student who says, I'm really struggling, I'm unhappy, or I just don't feel good. You know, you could have a brainstorm about self-care things that they like to do. For most students, especially those transitioning into high school or undergraduate or master's work, you probably want to have a discussion about what time management looks like at their sort of level of the game and how they might benefit from being a little bit more deliberate with their scheduling. Group classes are another great opportunity to introduce things like mindfulness, yoga, relaxation techniques, and just reinforce general health and well-being. Okay, if a student comes to a lesson sick, send them to the doctor, tell them to put the horn away. We've all played with illnesses, but if we are establishing a foundation of good health means good horn playing, why would we tell them, hey, your lungs feel horrible right now, let's play a Strauss horn concerto? It's just, the two things don't go well together. And not to mention, you don't want to be spreading that around to yourself and to the rest of your students. COVID has made us all very mindful of that. So what's the best way to check in with students? And I think it's really simple. I just ask them how they're doing, and I try to listen. Chronic stress and anxiety, poor physical health, lack of community support, these can all result in poor performance and potentially an injury. More importantly, this genuine curiosity about the student's well-being results in a community of support and understanding for the whole people that we teach. An activity I like to do sometimes in studio class is to have everyone share a win and a woe from the last week in the practice room. From a teacher's perspective, it's fascinating to hear what they notice and what advice they might offer their peers. Another idea might be to have them keep track of their schedule for a week. What did they do every day? Just write down kind of, how did I spend my time? then you can go over that with them individually or together and recognize, oh, you know, I'm not making time for my self-care and I need to do that. Or, hey, I thought I was practicing enough, but I see that I had some opportunities that I missed. It's just a great way to engage in that healthy habit skill. As I wrap up my discussion, it's important to address this topic. It's a little bit beyond the scope of one person, one student, or teacher. And that's the culture within music education, both at the K through 12 and university levels. It's really important that we all take a moment to recognize that music is a community activity. We may practice alone, but we're practicing to work together. And I think COVID, again, has made us really aware of the community nature of music. And I know I've missed it, as I'm sure many of you have. So some ideas for building a community of support. First, I would suggest having a buddy system for new students. New students are often a little bit scared, don't really know what's going on, and have a lot of questions. So having an older student who can check in with them regularly, and maybe they'll talk to them about things they wouldn't talk to you, it's just wonderful. Horn choir, such a fun experience. Everybody loves horn choir. I don't know anybody who doesn't. It's like a great way to come together and make some really fun music. Student-led masterclasses can be really great for students getting experience, offering constructive, helpful feedback, and you get to hear what they say and maybe add some comments to it, highlight things that they missed. It's very helpful. Having other faculty members or other horn teachers come in can be a wonderful way to give your students a sort of shared experience of either something maybe intimidating, maybe all of them feel a little excited about that person coming in, or if let's say it's another faculty member from your program, it can be just a great way to continue connecting outside of the studio, reinforcing good concepts and things like that. I love to do activities whenever possible. Now I know as teachers, we have very busy lives performing and taking care of families and doing a lot of different things, but whenever possible, it's so great to take your horn students, whether they're sixth graders or college students, to concerts, lectures, horn workshops, or just to have a meal, have some pizza together. It can be really fun to take the pressure off, put the horns away, and just enjoy that community space. This might not seem like this is about community, but most importantly, work with your ensemble directors, the band or the orchestra teacher, if it's not you, to have a rotating part system in the large ensembles. Whether this is just for horn or flutes, or I think this is great for everybody, because a rotating section means less pressure on one or two students and tones down unhealthy competition or jealousy among the students. It's an all-around healthy choice and gives everybody a variety of experience. Finally, I mentioned this before, but weekly lesson check-ins are a great opportunity to hear from students what all they have on their plate, not as an excuse for why they aren't prepared, but to open that door for conversation and time management. You might be concerned, as I know a lot of people are, about getting too personal with students, and finding the right balance can be challenging. I found it very impactful to share stories of my own experience that's both good and bad, but stick to musical settings. We don't have to get into specifics of a situation to say to a student, wow, I've been there and I know what you're going through, or let's talk about what you need. Maybe it goes without saying, but I feel the need to state the obvious, which is that it's hugely important that a student feels comfortable coming to you, their primary teacher, if they think they have an embouchure overuse injury. You are their first line of defense for both reassurance and understanding of how to proceed. And you may be able to take an advocate role for them in classes they may have to complete, in a recital that they have coming up, just so that they're sure that it's being taken seriously. For the final portion of this presentation, I'd like to take the many pedagogical concepts and ideas that I've given you and present them in a way that's geared towards injury management or rehabilitation. I'll supplement these ideas with a few more specific to players who are injured. And the following is a summary of my first blog post on this new resource website, brassinjury.com. So when I was first injured, as I shared with you, I realized that I didn't know anything about embouchure overuse injury. And so I created this list for myself and for my students as a starting place. So this isn't meant to be comprehensive, and it's not meant to be in order of priority. It's just 10 ideas if you think you're injured. So the first idea is to be kind to yourself. Know that many players have had the same experience and come out the other side happy and healthy humans. You should listen to your body and your playing. Subtle changes in feel or sound can be indicators of something amiss. So take it seriously and get curious about what's going on. Mindfulness meditation can be a good starting place if you're having trouble with this. Like I mentioned before, my own injury, I wasn't even aware of the swelling and the pain that I was experiencing until I took a moment to stop and just see what was happening. The third idea is to find a community of support. So knowing you're not alone is important. Talking with others who know what you're going through is so extremely beneficial. If you're in school, go to a teacher you're comfortable speaking with. This could be your private teacher or maybe someone that you trust, that you've worked with. You can join the Facebook group that I'm starting called the Brass Injury Community. I hope that that will be a great resource of people and support for anyone who's injured or has been injured. Friends and colleagues and family may or may not be in a position to empathize with the stress, anxiety, and confusion that can accompany an injury. So be mindful of who you surround yourself with during this vulnerable time. Number 4, seek out medical professionals. Okay, it's scary and it feels like it's a bigger deal when you do that, but it's so important because you might just have some underlying conditions. It might just be that you need rest, but just talking to a doctor is really a good starting place. So start with your primary care physician, get a general checkup, have some blood work done. Underlying conditions can contribute to a musician's injury. For example, I had a vitamin D deficiency. I did not know about this until, maybe even a year after my injury. And vitamin D is essential for healing tissues. So I don't know if that contributed or not, but had I had that blood work done sooner, I could have had that taken care of sooner. If you need a performing arts medicine specialist, they are available and searchable by specialty and location, visiting the Performing Arts Medicine Association's website. That's artsmed.com. And they have a little button there, referral. So you can search for that and find someone who can help you with your specific area. There's also some well-known brass practitioners that are listed under the practitioners on brassinjury.com. Number 5, rest and recover. Keep in mind that every musician and injury has different needs and varying timelines. You cannot ask someone, how long will it take to recover? Well, we don't know. And Jena Gilley did a really good job talking about that in her presentation at the last IHS and in her subsequent article. So you may need total time off, or you might just need modified playing strategies. But the important thing is that you're listening to your body and following what makes sense. As much as possible, I suggest that you clear your schedule to allow for healing. This advice was given to me, and it was crucial to not have the stress of a concert next week or next month, even to just be aware of that. Hot and cold packs can be helpful for reducing swelling and increasing blood flow. I also think that I had some nerve pain, and actually a hot pack felt better for me in terms of soothing that nerve pain. Do be aware of the dangers that can be associated with anti-inflammatory medication. So they can have an impact on your stomach, and they can also affect your hearing. There's some great research articles out there about hearing loss as a result of NSAID medications. Moving on here, number 6, as I mentioned before, Alexander technique is something that I'm most familiar with. So I suggest that you find an Alexander technique professional to work with if possible. Learning how to use your mind and body in an efficient and easy way will contribute to both your recovery and your future playing. Alexander technique is beneficial at every stage of the process, and it can be done with or without the instrument. So that's nice when you feel like you can't play. You can continue to work on that body usage and feel like you're working towards your musical goals as well. The American Society for the Alexander Technique has a list of teachers by state, and many teachers are now comfortable working online. So don't let location hold you back. I'm very rurally located, and I've been very lucky to work with Stasia Sienna frequently this year online, and that's been wonderful. Some of you may know her from the Kindle Betsworm Camp. So number 7 is to check in with your mental health. Injury can have a huge impact on your emotions, your perspective, and your approach to the instrument. You'll find this very clearly in Lucinda Lewis's work. She talks about that. In Jena Gilley's presentation, she talks about that. If you read through some of the accounts of injury, everyone pretty much mentions how psychologically difficult it can be to be an injured musician. So you can find a list of self-care strategies. This is a great time to just make your own list of things you love to do and things that make you feel happy and whole outside of music, perhaps. Your health insurance or school health center should have a list of licensed therapists, and that Performing Arts Medicine Association, you can always check back with them because they may have some specialists that work with patients via telehealth, especially in the area of mental health and performing. Learning about the anatomy of air and embouchure, I've talked about this already in great detail today. So this is just recognizing that understanding how things work can help you pinpoint the source of your injury and some of those changes that may have occurred as reactive habits over time. Check out those resources I mentioned before. Finally, reading about wellness and injury can be a great thing. This might be one that you're not ready for in the beginning, but as you feel like I'm ready to hear more, or I need to address this in a new way. There's 3 texts that I recommend you start with. The first one is called Playing Less Hurt, an Injury Prevention Guide for Musicians. This is by Janet Horvath. Although it's called a prevention guide, a lot of preventative measures are applicable to the healing process. There's a great book on Alexander technique that's wonderful to read, even if you haven't worked directly with a teacher. It's called Alexander Technique for Musicians, and it's by Kleinman and Bukoke, or Bukoki. I'm not sure how to say that. And finally, Broken Embouchures and Embouchure Rehabilitation by Lucinda Lewis. And she has a lot on her website, embouchures.com. So you can always go there and check out what she has available to read before ordering the books. Finally, it's so important to work with a supportive music professional. Having someone to play for is essential to your recovery. So seek out a music professional with whom you can be vulnerable and trust their insights. This might be a current or former teacher, might be a colleague or a close friend, but it's important that they have a professional concept of sound. So they need to be able to hear you and be a good reflector of what's happening. I highly recommend, if you're injured, check out Brass Rehab on Facebook. This is the program that Frankie Losurdo has done with Dr. Ackerman, who I mentioned earlier. And he's a positive source of knowledge and rehabilitation ideas for injured players. And I know he's working with people online from Australia. So my final thoughts today are that every injury and recovery is different, but almost all injuries can be recovered from. Please keep in mind that you will find more success with a holistic approach that includes your mind, your body, and your musical self. I want to thank you all for checking into this conversation today. If you have any ideas, thoughts, anything, questions, I would love to hear from you. My email address is je-gardner2@wiu.edu. And of course, I think you can find me, my profile here attached to this lecture. So don't hesitate to reach out. I'd love to hear from you in any capacity. Thanks so much.